Good day, everyone. My name is Gigilin Velasco from Sasn, Quezon City. So now, I'm performing supplying oxygen inhalation. Oxygen administration. Definition. Method by which oxygen is supplemented at higher percentage than what is available in atmospheric air. Purpose. To relieve dyspnea, to reduce or prevent hypoxemia and hypoxia, to alleviate associated with struggle to breathe. So these are the equipment that we are needed. Client's chart and cardex. Oxygen connecting tube. So let's assume that this is a oxygen connecting tube. Flow meter. Let's assume that this is a flow meter. Humidifier filled with sterile water. So let's assume again that this is a humidifier filled with sterile water. Oxygen sources or wall outlets or oxygen cylinder. So let's assume that this is a oxygen cylinder. Tray with nasal cannula of appropriate size or oxygen mass. A kidney tray. Adhesive tape. Scissor. Oxygen stand. Gauze pieces. Cotton swab if needed. No smoking sign. And gloves if available. Procedure. Nasal cannula method. Check the client's prescription including date, time, flow liter per minute, and methods. The rationale of this is to avoid medical error. Perform hand hygiene and wear gloves if available. The rationale of this is to prevent the spread of infection. Assess the client into a high collar position. And then explain the procedure to the client. So, ma'am, I'm Gigilin Velasco, your student caregiver for today. So, can you state your name, please?
Yes, Velasco.
When is your birthday?
August 26.
Okay, thank you, ma'am. So, I'm going an oxygen administration to you. So, is that okay with you, ma'am? Okay, thank you. Blow out dust from oxygen cylinder to prevent entering dust from exit of cylinder to the nostril. Attach the cannula with the connecting tube to adapter on the humidifier. So, let's assume that this is a nasal cannula. So, we are going to attach the connecting tubing into adapter in the humidifier. The rationale of this, testing flow before use is needed to provide prescribed oxygen to the client. Adjust the flow meter setting to the ordered flow rate. The flow rate via the cannula should not exceed 6 liters per minute. Higher rates may cause excess drying of nasal mucosa. Insert the nasal cannula into client's nostril. Adjust the tubing behind the client's ears and slide the plastic adapter under the client's chin until she is comfortable. Of this, proper position allows unobstructed oxygen flow and eases the client's respiration. Maintain sufficient slack in oxygen tubing to prevent the tubing from getting out of place accidentally. Encourage the client to breathe through the nose rather than the mouth and expire from the mouth. Breathing through the nose inhales from oxygen into the trachea, which is less likely to be exhaled through the mouth. So now, can you inhale through the nose and exhale through the mouth? Okay, that's good. Initiate oxygen flow to maintain doctor's prescription and avoid oxygen toxicity. Assess the patient's response to oxygen and comfort level. Anxiety increase the demand for oxygen. Dispose of gloves if you wear and perform hand hygiene to prevent spread of infection. Place no smoking signboard to entry into the room. The sign warns the client and visitors that smoking is prohibited because oxygen is combustible. This is the smoking signboard. We put it here. Document the following: date, time, method, flow rate, respiratory condition, and response to oxygen. Documentation provides coordination of care. Sometimes oxygen inhalation can bring oxygen intoxication. Sign the chart to maintain professional accountability. Report to the senior staff to provide continuity of care and confirm the client's condition. Check the oxygen setup, including the water level in the humidifier. Clean the cannula and assess clients. Narrest at least every 8 hours. Sterile water needs to be added when the level falls below to the line on the humidification container. Nares may become dry and irritated and require the use of water-soluble lubricant. In long-use cases, evaluate for pressure source over ears, cheeks, and nares. So that's all. Thank you.